Good day, everyone. My name is Arash. For those of you who don't know me, I am Shahzad's fiance. My fiance was diagnosed with leukemia, type AML. She was diagnosed in September 2012. She had the disease for 15 months, and she felt this courageously, and she just couldn't go on no more, and she died of infection and also the progress of her disease. Being a cancer patient is not an easy thing, especially when you are inpatient and when you are in the hospital. One of the things that you're dealing with is obviously having your own private room. The difficulties you are having with people coming and going. You just want to get out of there and just go back home and continue on with your treatments at the privacy of your own home. So being an inpatient is always a very difficult thing. What makes it more difficult, one thing I've noticed, in most hospitals in Toronto, they're mostly located in downtown Toronto, where there is rush hour, pollution, in a place where there is anything but that relaxation where a cancer patient or any other patient, I should say, would need. Coming out of the hospital, you just want to spend some time, relax, not thinking of where you are exactly, what you're doing, and why you're there to begin with. And most of the hospitals in Toronto does not give you that feeling. Whether you're inside or outside, you're just surrounded with concrete walls, lots of cars, noises, and people who are just rushing around. And it just gives you that feeling that you're in a city and you're just trapped in a hospital. The project that Elika is working on, I believe, in my opinion, is the greatest thing ever. It's just because while that cancer patient, or again any other patient who needs to be an inpatient in the hospital, at least finds time to just kind of imagine themselves out of the walls, out of that situation that they're in for that moment. And that is priceless. I would say it's something that every patient needs to picture themselves as a happy person, as a healthy person who can just go anywhere, do anything, and just be anyone. We know that when you are, diagnosed with any sort of a disease, for some number of reasons, I should say, you cannot really travel. You can't just be anywhere and go anywhere. But at least with what she has in mind, with what Elika has in mind, she's bringing that, I would say that imaginary place to them in a way where there is, lots of green space, lots of great environment where they can just walk around, hear nothing but the birds chirping and the waterfalls and everything. This is something that our hospitals should spend more money on, because again, being in a hospital, having great medication, great doctors, great nurses is one thing. Keeping in mind that this patient was just a normal person just a few days ago, a few months ago, and these people need to be in their relaxing environment. And again, bringing it to them, I would say it's a great idea. How she has planned it, I think it works, all year round. She had every other season in mind, so this is not something that's just going to work in the spring and summertime, especially when we live in a city we live in, where there's 6 months of year where there's snow and in a climate where it's not possible for a patient to come out and just have a walk on the streets. Great idea. I think every single patient that he talked to would agree that this is something that they would need when they go to hospitals. We can't maybe move the hospitals out of the cities. Maybe it's very costly. Maybe it's just not possible. But we can kind of bring that suburban look into the hospitals and just inject it with some green space, lots of area to walk around and just feel themselves just a normal, just like a normal person, at least for a few days or a few minutes that they're out or whatever. Thank you for the opportunity. Hope this project works. Hopefully soon enough we can have this in every single hospital. And again, just consider a patient as someone who needs, yes, medication to go on and defeat the disease and get better, but yet in that progress they need to be treated as a normal person. And a normal person does not belong in the hospital environment that we're currently dealing with in Toronto. Thank you very much. I hope you all have a great day, and hope to see a day where there's no patients, so there's no need for a hospital, so we don't have to sit down and talk about this thing anyways. Thank you.